Good evening, Foxy, and everybody who's taken time tonight on the Lunar New Year. So, this is the first day of the Lunar New Year, a very auspicious day indeed. And we have started our episode number 1 for a beautiful series that we have carved. It's called Gyan Pravah. So, in Hindi, it means Gyan Pravah and it means the flow of knowledge. And we will be inviting people who have aced various pillars and avenues of life, profession, socially, or in many other ways. So it will be a variety of people that you'll see almost every evening. So we are starting tonight. And the whole concept is designed by our president, Fogsi, Dr. Sunita Tandulwadkar. So I would first want to introduce her. Dr. Sunita Tandulwadkar is the president of Fogsi 2025. She's a distinguished obstetrician, gynecologist, and fertility specialist based in Pune in India. She serves as a head of Obs and Gynec unit and chief of IVF at Ruby Hall Clinic and is the founder and medical director of Solo Clinic IVF and Alive Stem Cell Research Center. She has held prestigious leadership roles, including president of Fogsi this year, and also the Indian Society of Assisted Reproduction for 2 years from 24 to 26. She's very soon also going to lead the Indian Association of Gynec Endoscopy and has contributed significantly to ovarian rejuvenation and reproductive medicine in her vast career. With 18 authored books, 85 publications, and invitations to over 400 national as well as international conferences, she's a key figure in the field. She played a pioneering role in achieving India's first stem cell assisted baby in 2018. Dr. Tandulwadkar has received numerous accolades, including the Bharat Gaurav Puraskar in 2019 and Best Medical Practice Award in Europe by the European Committee in 2016, and recognition from the President of India as well. Her contributions continue to shape advancements in reproductive health and fertility treatments globally. And I would also want to mention that this year in the month of May, she will be honored by the Royal College of Obstetricians and Gynecologists here in London with the Fellowship Honoris Causa. And that is a beautiful jewel, in another one in her hat. So I please welcome you, madam, to please deliver the welcome note to all of our listeners.
You, Anu. Thank you for your kind words and kind introduction. Friends, you all know I have taken over on 9 January 2025, and there are a lot of academic and social projects we are working with. To mention a few, you should be knowing the Gyan Pravah, most important of all academic project. We know the Fogsi organization work with the president, the vice president, and 30 committee chairpersons. When I was designing my academic and social projects, what I realized is the chairpersons work very hard, but unfortunately, they don't get the platform what they deserve. And the webinars, the way webinars are happening in last 5 years in India are too much of a crowding of the webinar in a one day. Every committee chairperson wishes to do. I don't know how much is the attendance for it. So we decided why not to have 30 chairpersons have been given 30 days. So Dr. Anu Chawla, on 29th of every month, you will get to hear. So similarly, from 1st to 30, we have given all committee chairpersons, and you will see the dedicated interview, maybe in the field of our academics related OBGYN, it may be a politician, it may be a social worker, from any field they be allowed to, and there will be a crisp interview. So I request all of you, whether you are driving, whether you are having food, just put your Bluetooth and keep on listening to this podcast series, and you will not be bored with the webinars this year. Most important thing is I felt these committee chairperson, they are very creative. They are very knowledgeable. They are enthusiastic and they want to show their enthusiasm. And that's why Gyan Pravah, this is a flow of knowledge every night. Be with Foxy and be with Foxy. I also request you all to visit the website, which I have, I think, last 8 days worked very hard to put up all the projects. During my election period, when I roamed across the country, I realized many members, they are creative, intelligent, but unfortunately, since they are not in a chair, they are not able to contribute. So I have come out with the 7 publications where each and every one of you will be able to contribute. These publications are very simple, like prevalence of anemia in pregnancy, prevalence of mental health in a perimenopausal age. Simpler, you have to just fill up the Google Forms. They are there on the website. So please join Foxy every moment. My theme of the year has one tagline, Har Ghar Foxian. Dear Foxians, I love you and I congratulate Anu for selecting none other than Adam Ballon. Today with the ICOG, we had a PCOS series going on and I was thinking, what a coincidence. We have Legion today. Anu will be giving complete introduction of him. He is there, Adam. I'm so thankful to you for joining Foxy and be the opening batsman. If the series starts with A and B and Chawla with the C, I think it will run like anything. Thank you so much. And Anu, back to you. And I'm thankful not only to Anu, but every committee chairperson. I will be there with you all, but I'm proud of you. And you are the pillars or the state cabinet ministers where the Foxy runs on your shoulders. Thank you.
Thank you so much. That was very, very thoughtful and very kind of you to be. See, that is what we know about you, and that is what we're going to get this year from you. So, very happy to start now, and I'll now introduce Dr. Professor Adam Ballon, a true legend in the field of reproductive medicine. He's an NHS consultant and leads teaching hospitals with a personal chair in reproductive medicine and surgery. And in terms of his clinical leadership, he has led large multidisciplinary reproductive medicine services, including the pediatric and adolescent gynecology. And the key contributions have been in the field of polycystic ovary syndrome, contributing to international consensus groups on its definition and management in the CRE PCOS guidelines in 2018 as well as 2023, and member of the WHO Guideline Development Group in Infertility. And he has also led the FIGO classification of ovulatory disorders in 2022. And professional leadership points would be that he's been the past chair of British Fertility Society, and also he has chaired the SIG in ESHRE for the reproductive medicine. He has served in the Royal College of Obs and Gynecology Council for 6 years, and then founded the Fertility Education Initiative to improve reproductive health education in schools. He has authored 280 and more papers with the H index of 83, with 48,000 citations, and published 16 books, including 2 very important ones, which are Infertility in Practice with the 5th edition in 2022, and another book which he co-authored with his wife, Grace Dugdale. And that is a very popular book on Amazon, which is the Fertility Book, and released in 2021. So welcome, Professor Adam Ballon. Would you like to say a few words before I start firing my questions?
Well, first of all, thank you so much. It's a huge honor to have been invited to kick off this series. And Dr. Tandulwadkar, thank you so much for the kind introduction and your vision for your presidency, I think, is outstanding, and I know all that you've achieved historically, and I know there's a huge amount more that you will achieve in this very important year for you. And Anu, well, Dr. Chawla, Anu, we know each other well, but thank you so much for asking me to kick off this series. It means a huge amount. Fogsi is a tremendous organization, far-reaching, huge membership, and to ask me to speak in one of your podcasts, I have to say, is a true honor. So thank you so much, and thank you for that kind introduction. So I look forward to our conversation.
Yeah.
You, Anu, as the protocol goes, I'll be leaving and I'll be joining. So only both of you will be in the frame, and I'll be taking another delegate link to join and hear both of you. All the best and love you. Thank you.
Thank you very much, Dr. Tandulwadkar. So here we go, Adam. So the only reason that I selected for you was not just the initials of your name, but you're a true legend. So we want to know you more tonight. And the first question would be, as a distinguished leader in the reproductive medicine, you have witnessed remarkable advancements in the fertility treatment. In your view, what have been the most transformative developments over the, say, past 1 decade?
That's a really interesting question, and I've been very privileged to have been part of this journey. You know, when I started in medical school in 1978, that was the year that Louise Brown was born, and I ended up working with Bob Edwards a few years later, and some of the greats in reproductive medicine. So I've been very privileged on my journey. There have obviously been some huge changes, and I suppose in the field of assisted reproduction in the last 10 years, one of the biggest developments is the widespread use of pre-implantation genetic testing of embryos in IVF, but that's looking at the real high-tech end. And I think it's very important to sort of distinguish between what's available with high-tech IVF, which obviously is costly and needed by many, but I think we mustn't forget and focus on the needs of those who are trying to conceive naturally, how to assist them, how to educate and promote preconception health, which actually we were having a discussion about earlier. And I know that that's one of the big aims of this year in Fogsi, and a great passion of your president. Sunita obviously has got a real vision here, and I harmonize with that. So to take a step back away from the most advanced form of treatment and understand what the population needs to improve general health, preconception health, the chance not only of conceiving naturally, but also having a healthy pregnancy and a healthy baby at the end of it, I think is really important. And whilst I run a very large IVF clinic here in Leeds, I believe that reproductive medicine is so much more than IVF. It needs to cut across the whole of fertility care. And we mustn't just go to IVF as a first-line treatment. So in the context of polycystic ovary syndrome, improving our protocols for ovulation induction, for example, I think, and we may come on to that later, rather than go straight for IVF for those with PCOS is again something that we need to take a step back. So there are many ways to answer that question. You know, what has changed in the last 10 years? Huge advances, and we may come onto in a minute sort of glimpses into the future with technology. But at the same time, we need to offer what's truly available to the majority in an accessible and affordable way as well.
That's very important, really, isn't it? Indeed. So rightly, you mentioned the technology is there, but what we do always is we really offer options and then let the patients choose. Every patient is also different, isn't it?
Yes.
On to the next question I have. So polycystic ovary syndrome is your key area. What do you believe is the most misunderstood about this problem?
Again, a very interesting question. I mean, PCOS is multifaceted, and I think because it's a syndrome, it's a constellation of signs and symptoms. And as you rightly said just now, every individual is different. And one woman's PCOS isn't the same as another woman's PCOS. And in fact, the routes to developing polycystic ovary syndrome may differ from person to person. So there are a number of different components of its pathophysiology. So I think, again, trying to understand the individual needs and how things may differ from person to person. And to coin a phrase when it comes to management, one size doesn't fit all, and you need to look at the individual and tease out the components that are important to her and then focus on them. As far as misunderstanding, I think one of the um, big issues is body weight and how that affects ovarian function and how it can be managed safely. And whilst there is no doubt that the metabolism for women with PCOS is different from women who don't have PCOS, they find it easier to gain weight, harder to lose weight, and that's for multiple reasons, which again we could go into. Um, Polycystic ovary syndrome is common. Weight problems are common. You can't always blame one for the other, and vice versa. And similarly, many other conditions coexist with polycystic ovary syndrome, which we must remember as well. And an individual's nutrition may impact on their ovarian function and their fertility. And that needs to be dealt with. You can't just blame PCOS for gaining weight. You have to, you have to manage the whole. And it's very easy to sit behind PCOS as the explanation. I think it's our responsibility to ensure that we understand the full spectrum of the condition, and also that other conditions can coexist and need to be properly managed as well.
And there's a lot of place and role for an empathetic approach, because this can be too personal for some individuals. Nobody wants to gain weight. But when it is told that it is associated with something that is wrong with them, it can be a little shattering to know and realize. So it's very important, that hand-holding at that right time.
You couldn't be more right. And I think, it's sadly, we're often constrained by time in our consultations, and it's very easy to dismiss somebody and say, go away, lose weight, come back when you've lost weight. It doesn't happen like that. And that's where you need supportive healthcare professionals, our nurses, psychologists, nutrition experts. I mean, it's something that you've already heard. Grace, my wife, is an expert in reproductive nutrition and holding people's hands, recognizing that they have a partner, a husband, sisters, family members, many of whom may also be experiencing the same thing. So bringing everybody together, bringing everybody on board, understanding that it's not easy just to go to a gym to exercise if you have concerns about your bodily appearance, whether it's facial hair or being overweight. That can be a big psychological issue. And we've published a lot actually on the psychological impact of PCOS from adolescence all the way through life, remembering, of course, that PCOS is a lifelong condition. It does tend to evolve during adolescence, but it can affect different people in different ways at different times in their life. And again, we need to be fully cognizant of how it changes, how to manage. And as you rightly say, I think your phrase, hand holding, is a lovely phrase and very, very appropriate.
Yes, I think you've put that all together beautifully. So the next would be publications.
Mm-hmm.
So you have contributed, Adam, extensively, and it is so impressive and inspiring to know the level of academic involvement and how you have shaped, actually, I would rather say, the subject. So what key insights would you offer on structuring the impactful publications, not just for Indian audience, but globally so, and especially in the new age of AI and possibility of plagiarism. So, I would want to know how a good, effective, impactful publication should be structured.
You've got some big questions for me today, which is always lovely, and a challenge. So I suppose the first thing I would say is I've been very lucky, and yes, I've published widely, but I'm a clinician, first and foremost a clinician. So I think the key to a good publication is understanding clinical needs and trying to address clinical needs, to look at the evidence and then try and produce appropriate research to answer questions that have a clinical need. And that way you can make the greatest impact. And I have to thank all the patients who over the years have willingly participated in the research. So it has to be proper research, in my view, grounded in solid clinical practice. I mean, if I go back in time when I started, I was in a laboratory. I did some lab-based research, and it's very exacting, and I have to say challenging for a simple clinician to be in a lab and understand what's going on. But actually, that did give me a good grounding in understanding the scientific methods that are used to underpin some of the research. And I've been very lucky to work, for example, in Leeds here with, amongst others, Helen Picton, who's well known for her research in ovarian physiology and the oocyte and freezing of ovarian tissue, freezing of eggs, fertility preservation. So to work with really good scientists, realizing my limitations and working in collaboration. And I'm a great believer in collaboration. And if you look at my publications over the years, you'll see that the first authors are usually my research fellows. So those youngsters who've come from all over the world actually to work for me, they are the key. That's why I enable them to be first author, and that keeps everybody enthusiastic and happy, and that keeps more publications coming. So a good research team. You mentioned AI and sort of some of the thorny issues that unfortunately are being uncovered with some, data that may not be used appropriately. You always have to keep your data. I'm not going to show you I'm in my office now. I have got shelves here of files with all of the data going back to the 1980s. I have kept all the primary data because somebody may ask me one day, and every now and then when people do systematic reviews and meta-analyses, they ask for the primary data from the randomized controlled trials, and we've got it all here. And so I think that's key as well. Ensure that you always keep your data so that you can share it and demonstrate that this is real data from real people undergoing the studies, and so it can be scrutinized. And I think that really is important too.
No, I think, and this applies to everything else in life. Authenticity has the strongest vibe, they say.
Mm-hmm.
So the content and authenticity can definitely be not overemphasized ever. So you have been a pioneering advocate for fertility preservation, and you earlier also mentioned your colleague's name, and it is always good to be surrounded by people who are pushing you to break those glass ceilings. How do you foresee the evolution of this field over the, say, next decade? We're not talking too far ahead.
Mm-hmm.
For fertility preservation.
Well, fertility preservation, I suppose that there are different components, aren't there? You have first of all, fertility preservation for those who are undergoing sterilizing treatment, say for cancer. You have to have a rapid access clinic. So we have the facility to offer people next day appointments and get them straight into a program. For sperm freezing is obviously easy, but egg freezing, we can kickstart a program within a couple of days to stimulate the ovaries at any time in a woman's cycle, and sometimes even get 2 cycles of egg freezing in before they have to start chemotherapy. So there should be sort of protocols for swift access to care. The challenges are for the younger, for the prepubertal girls and freezing ovarian tissue. We've pioneered that in Leeds. We've been able to do that in Leeds. It's the sort of thing that needs to be offered just in a few centres, I think, in order, because it's required less. And there are some regulatory issues as well. So historically, we have helped a prepubertal. I think she was 9 years old when she had ovarian tissue frozen. She subsequently had it reimplanted and has had 2 children in her 20s. So, that's an amazing achievement. Challenges also for prepubertal boys. Where's it all going in the future? Well, a lot of social freezing, of course. A lot of people are coming to us saying, can I freeze my eggs? Because I haven't yet met Mr. Right, or, my career is important. Can I freeze eggs for the future? And that's being sought more and more. And it certainly has a place. But again, it's very important that we have a full and thorough conversation about its limitations, particularly for people as they get older. Doesn't work so well, but our technology is actually extremely effective now. So, I'm in favor of offering that as an option. But fertility education, which again we may come on to in a minute, is key, and we need to support young people to start a family when the time is right, and not pressurize people into feeling that they need to freeze their eggs. Now, looking into the future, I mean, there's been an HFEA discussion. HFEA, the Human Fertilization and Embryology Authority, for those who aren't familiar, in the UK, regulates all of our IVF clinics. Just recently, we're discussing the potential for creating egg cells and sperm cells from somatic cells. So, for example, from the skin, you could take some skin cells and before you know it, create an embryo potentially. And this technology is being explored in mice. In the UK, it's not allowed in humans, but it's a watch this space. So potentially, who knows, in the future, I'm sure it will happen, that for those who haven't been able to freeze their gametes, or for those who may have gone through an early menopause, there may be the potential to create gametes from somatic cells, but that's something for the future.
That has given me some good spots. So yeah, Japanese team, Hayashi's lab, have done this, and I'm so happy. See, UK used to be this is the place where IVF started. So we were actually number one in research, but the regulations actually have made things very different. But I'm very pleased to know that in the deliberations, HFE has now brought this into their thoughts. So very excited. What's next? Yeah.
Yeah, I mean, regulation is obviously important. I think in the UK, it's healthy regulation. It's sort of permissive regulation. It's regulation that enables research in a controlled way before it is brought into clinical practice, which is obviously the most responsible way. The same applies to the use of CRISPR technology and so-called genetic engineering. I mean, the sky's the limit potentially, but it has to be very, very carefully managed.
True. In this day and age, nothing is more important than patient safety.
Mm-hmm.
So, okay, now I'm coming to something very interesting, which is International Federation of Obstetrics and Gynecology, FIGO. So FIGO, we know, plays a pivotal role in shaping global standards in obstetrics and gynecology. As someone who has contributed to the development of international FIGO guidelines, could you share your insights into the process of formulating the new FIGO classification of ovulatory disorders? And additionally, you've also been the member of the Guideline Framing Board for PCOS. How has your expertise influenced the evolution of international recommendations to manage this condition?
I think an international guideline groups are so important because it brings people together from around the world, which can only ever be a good thing. Bringing people with different perspectives, different ideas, different experiences, looking after different populations, of course. And FIGO is a really important organization globally. And I've been privileged also to work for the World Health Organization, which only recently has our guideline group sort of completed the global guideline for the management of infertility, and that's going to come out fairly soon. It's very interesting, the disorders of ovulation classification. I looked into the history because initially it was the WHO classification, which everyone will be familiar with. And this was put together by a group of people sitting in a room in Geneva in the 1970s, never published in a peer-reviewed journal. It was quite pragmatic, but again, I always found it a little bit confusing, grade 1, type 2, and type 3 disorders of ovulation. It's a real catch-all, and you have to recognize that for many women, ovulatory function can change over time, changes in body weight, for example. Ovarian function can fluctuate. Ovulation or anovulation isn't always absolute. So you have to be sensitive to this. So what we put together in FIGO was, first of all, a group of international experts, representatives from patient organizations, societies from around the globe who inputted as well. And this applied to the global PCOS guideline also. Very important to engage with key professional organizations, the patient groups, some people like to call them consumer groups, but the engagement of those for whom these guidelines really at the end of the day matter. And then you go through a process of not only looking at the evidence, synthesizing the evidence, realizing that there isn't always evidence for everything, and sometimes you have to recognize that there are gaps and potential research needs, so you have to take a pragmatic approach as well. And with respect to the disorders of ovulation, we realized that simplistically, you have the hypothalamic, pituitary, and ovarian causes, which can be subdivided depending upon whether it's genetic or autoimmune. I mean, I won't go through the whole list, but we put together this sort of sieve of a classification, which is facilitative. In other words, it enables flexibility to add in additional diagnoses over time if they become apparent. And the one key thing that we did is we took out PCOS, recognizing that it's such a mixed bag, because PCOS isn't only ovarian or pituitary or hypothalamic, all of it can be involved. So we called it, rather simplistically, the Hypo-P classification: hypothalamus, pituitary, ovarian, and the P for PCOS. Published a very big review, probably the longest paper I've written, actually, published in Human Reproduction Update last year. I think we published it, and I've got a review coming out in TOG, the obstetrician and gynecologist, produced by the RCOG. So there was as a teaching aid, because I think the key thing is it's not only about giving a diagnosis to the patients, but for those who are finding their way in reproductive medicine, having a reliable source to learn from and to teach others with.
Great. So now I'm going to a little overarching step back and little broader view, and which is, how do you envision the future of gynecology evolving in the years to come? Sorry, it's a very overarching, broader question, but that is where I want to explore your thoughts. What do you see as a future?
The future of gynecology, that could be a 5-day meeting, couldn't it? The future of gynecology. Well, I suppose it depends on your perspective and where you are in the world, because I appreciate it'll be very different in India, maybe compared with in the UK. Talking from a UK perspective, and I appreciate many in the audience will have been to the UK at some stage. hopefully to visit, maybe to have worked. I think there have been some problems with training, for example, and the ability to get a full grounding in the range of operations that are required. And certainly certain surgical procedures are no longer required and have been replaced by medication or simpler outpatient procedures. So I suppose the future of gynecology, I would say, can be split into focusing on so-called office gynecology, in other words, what we can do in our clinic simply, but trying to provide a one-stop shop, instant diagnostics, getting the results of hormone blood tests and other tests straight away, having an ultrasound scan available so that you can be efficient in the way that you make a diagnosis and offer management. And I think inevitably there are going to be fewer gynecology specialists performing surgery. And so I think there will be hubs for, for providing sort of outpatient gynecology. And that's been, a big project of our former president of the RCOG, Dame Leslie Reagan, who's developed the women's health hubs. I'm speaking to our local hub in Leeds actually only next week, so I've been involved in educating and teaching in the women's health hub. So I think that is a really good philosophy, and then ensuring that we have centers of excellence providing safe surgical procedures, because of course you need to have a volume in order to be able to provide it safely. So that's gynecology. Obstetrics is another issue. I mean, you haven't included obstetrics in your question, and that's a big issue and vitally important around the world to improve maternal safety from preconception all the way through to the birth of a healthy child. And we all know that of the challenges, and I think one of the big challenges is appropriate staffing of our units with not only qualified obstetrician gynecologists, but also midwives and other healthcare professionals, and recognizing the value of our colleagues in allied professions to ensure that we provide holistic care and support and cost efficient services that actually have good outcomes. But huge pressures around the world, I know, on obstetrical facilities, and there's something that we have to address. We have to remember women's health is fundamental to the health of the global population, and the future as well, isn't it? It's the health of our future generations depends upon having women embark upon pregnancy in good health themselves, so that they not only have a healthy pregnancy and a good outcome for themselves and the child, but that it's setting the child up for their future as well, recognizing also that the global population is slowly increasing, but the replacement rate isn't being achieved in most countries around the world, and that's a big concern.
Yeah, that's true. So the demography is changing, the decline of fertility in some
Yes,
part of the world
yes,
is very concerning. At the same time, obstetrics practice is so non-uniform across continents. And very importantly, I think politicians are getting more involved in the women healthcare now more than ever before. For example, endometriosis has become a political policy making point in France and many other countries now. So very good sparks coming from around the world, but still very non-uniform. We'll go to something related to the Royal College of Obstetrics and Gynecology. Having served extensively on the RCOG Council and contributed to various college committees, what personal significance does the college hold for you? Moreover, how do you see its role in the future, more so than now? Because we are very clear about what the college is doing, some of the complaints that are being addressed and handled. And some very important policy making stuff that, yes, Professor Leslie Regan has been involved in, and she's now acing her new job as a health ambassador. So yeah, so what do you think, what more can the college do, especially in the next 1 decade future?
Well, I hold the college very dear to my heart. As you say, I've been involved for many, many years in all sorts of roles. It's a tremendous organization. And I think it's unique, actually, in its approach, because obviously its main remit is to look after the membership, but actually the far-reaching remit is actually global women's health and improving women's reproductive and obstetric outcomes around the globe by teaching, education, and engagement. And you know, there's a very strong legacy. There have been some great people. Our current president, Rane Thakur, is personally a very good friend of mine. In fact, I worked with her husband in a little mission hospital in South Africa some 40 years ago, which is where we started off, and my passion started off actually in obstetrics. But coming back to the college, you know, there have been some great people who have worked tirelessly around the globe, and I pay tribute to everybody, and I'm sure there are many listening who support with the various examination committees and, you know, help around the world with teaching, training, and examining. And to get our standards out around the world, I think, is really important. Recognizing also that you know, the huge amount of work that's done in different countries, and that the college mustn't sort of step beyond itself. It should be there in a supportive role to help, because, you know, there's a lot of resource. I actually think that we could be doing more in the education of women, girls and women. You know, I ran a whole day for the public on fertility, an open day with some keynote speakers, and that was all videoed, so it went on to the college website. That was just before lockdown. And since I've done webinars for the Women's Voices Network, which I think is really important. And I think the college needs to reach out, because in our current era of social media and instantly available Googling of information, I think it's very important that organizations such as the RCOG, such as Fogsi, and I know Fogsi does this as well, puts out reliable information so that you can signpost patients to appropriate information, evidence-based, because there are many people out there making false claims, or maybe advertising services or supplements or other things that may have a benefit for some people, but shouldn't be provided in a blanket way to everybody. And I think at the moment, with the difficulty that many people, certainly in the UK at the moment, have in accessing their primary healthcare general practitioner, you know, it's a big issue. People are looking to help themselves, and it's easily available. And I think that needs to be regulated, difficult to regulate, but at the same time, this is where organizations such as the RCOG and Fogsi come in order to provide information. Now, if we're the first port of call, if somebody Googles PCOS, hopefully they'll see Verity, which is the national PCOS support organization in the UK, but they should see the RCOG as well, and should be signposted to reliable information, so that they're empowered to actually find the right way for themselves, and we should be there supporting them. So I think the college has got a lot to do and a lot to offer in that respect. I mean, there are many components of college activities, and for those of you who haven't yet been to the new facility in Union Street, and we all miss Regent's Park, which was a lovely setting. But actually in Union Street, we're in the heart of London, you know, heart of a big population, and many other allied professional societies have now moved into the Union Street facilities. So it's a real buzzing hub for women's healthcare, both policy making, research and guideline development. And so all I can see is, you know, more and more good things hopefully coming from this hub. But I think the key thing is collaboration and ensuring that our colleagues from around the globe join in, and that, you know, it's not the college taking ownership, it's everybody taking joint ownership of guidelines. And this is another thing I feel passionate about, coming back to your last question about guidelines. You know, you've got the FIGO guideline, you've got the NICE guideline, you may have a college guideline, you may have a WHO guideline. Don't need to keep reinventing the wheel. We should all collaborate, bring things together, and have a concerted effort to streamline these processes, to avoid sort of confusion as to, you know, how best do you manage preeclampsia or a postpartum hemorrhage. There are so many guidelines out there, and that's what the PCOS global guideline has actually successfully done. It's brought everybody on board, all the big relevant societies. I think there were 38 international societies who signed up to that guideline. So that is the future, I think, and that's where the college can have a facilitatory role.
So yeah, so you rightly mentioned that the wheel doesn't need to be reinvented, and college already have so much of material in the layman language in the form of leaflets. So patients do have the access to the very authentic data coming from the college. Now we are coming very close to the end of our show tonight. Before we close, I want to ask you quick rapid fire 2 questions. So these are quick rapid fire. So the first is, if you had an authority to implement an immediate reform in the approach of funding fertility treatments in the UK, what would it be and why?
Provide more than one funded treatment, because in the UK it's very restricted. We know that the economic, if you want to put it in pure economics, the economic benefit of a child born as a result of assisted conception far outweighs the cost of the treatment itself. So to enable couples to have a family, and not just restrict it to one. And of course, in the UK, we have a postcode lottery. So in some parts of the country, you don't get any treatment. In other parts, you may get 3 cycles. So to provide equality.
True. So the next question is, your contributions extend beyond clinical practice, significantly influencing parliamentary policymaking and think tank discussions. So from the socio-political standpoint, what key issues are currently at the forefront of these deliberations? Could you offer insights into the primary area of focus and debate at present?
Well, I suppose one thing that I've really been passionate about is the fertility education. You know, I started the Fertility Education Initiative when I was chair of the British Fertility Society. We actually have changed the national curriculum in schools to include information on reproductive health in the sex and relationship education lessons. And we've produced some validated educational material for teachers that's been approved for dissemination around the country. So that's already out there through the PHSE Association. It's available online. So simple teaching aids for teachers to enable them to give appropriate information to young people so that they understand that family planning isn't only about preventing an unwanted pregnancy, it's about planning for a pregnancy when the time is right and knowing the things that will influence their opportunities in reproductive health. So it's all about education. To coin an old political phrase, education, education, education is key, and empowers people with the knowledge then to steer their own path through life.
So thank you. It was a deep insight into how your thoughts work in the line. You have actually gathered huge, immense, respectable position in the subject of reproductive medicine. although you call yourself mainly a clinician, but the influence in shaping the subject is very social and even influencing policy making people, I'm sure. So thank you very much. And we are close to now saying bye to everybody. Thank you for joining us tonight. And please join every night, every evening. This is a beautiful concept. You'll be watching different people from different avenues. There will be some Bollywood stars, politicians, who knows. So